Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show. Our goal here is to find the best experts to help you decode some of the complexities out there in dentistry to create a better practice and a better life. And Zirconia keeps coming up. The complexity is pretty high and it's changing a lot. So we brought on one of our friends, an expert, Shashikant Singhal, and he decodes this to make it a little bit more simple for us on the whys and the whys of Zirconia. So please listen up. I hope you guys enjoy it, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. One of the hardest things to figure out in dentistry is what materials should I use? And if you're familiar with Zirconia, you might not be, because one of the biggest challenges dentists have is figuring out that there's more than one. There's actually three, and they can affect different clinical outcomes. And so I got my friend Shashikant Singhal on today from Ivoclar, and he's going to walk us through how all that works. Josh, thanks for being on, buddy. I appreciate you.
Thank you so much. And I'm really excited to be here.
Well, I'm excited to have you here. And Ivoclar has been a longtime partner of ours, success partner. I'd love for people to know who you are before we get started. Give us a little bio.
Yeah, Kirk, my name is Shashikant Singhal, and I work at Ivoclar as a director of education and professional services. My background, I'm a dentist. I do have a materials degree as well. And I'm currently working on my MBA also. So again, with all this education, I'm trying my best to manage the education for Ivoclar. I do participate in the product development as well. I do work with different clinicians, lab technicians, dental expert on the product development. So yeah, I try to wear multiple different hats on that. So every day is exciting.
Yeah, and we're going to have you back and you can explain how you do that so I can learn how to wear multiple. I may have a hard enough time wearing one. So, give us a little background. You know, you and I were chatting before we hit the go button. This is actually a bigger problem than most dentists really anticipate. Why?
Yeah, Kirk, again, dentistry is changing fast, as we all know, right? The clinicians are trying to have something in their hands, which is strong, reliable, and good looking also. But at the same time, there are so many different options that are out there in the market. And it makes it difficult for them to make a right decision. We talk about ceramic materials as one of the options for indirect restorative products. And things have evolved. Things have evolved over a period of time. If we will say we started from feldspathic ceramic material, we moved to lithium disilicate. Now everyone talks about zirconia. And as you mentioned, it is, do we understand these products in a proper way? What are their properties and why it is important to understand these properties? Because it defines the clinical protocol. So yeah, so it's kind of like, it's very confusing. I lecture all around and I ask the question like, do you understand different type of zirconias? And I will request them to raise the hand. And I do see only handful of hands will be raised during the lecture. So it's a big problem, Kirk. And I'm glad that we are having that discussion today. And I'm looking forward to put some light on that as well, based on my knowledge and information.
Yeah, absolutely. Talk about the evolution of the GT technology. What is it? How has it evolved? And where are we at today?
Yeah, so Kirk, might be I will give a little bit longer answer for that one. So as we discussed it earlier, we were discussing it before this call, there are different types of zirconias, right? And it makes it really difficult for clinicians to understand which zirconia can be used where. Are these zirconia same? The answer is no, they are not the same. They are different type of zirconias. And if I will broadly classify it, there are three types of zirconia. Okay, one is the 3Y, one is 4Y, and one is 5Y. And the Y stands for the mole percentage of the yttria that we do add it into the zirconia powder. I will not go into the details on the science side. You asked the question, what is gradient technology? That is GT technology. So as I mentioned it, not all zirconias are same. What does it really mean? You do have a zirconia that is monochromatic, means one color. Okay. The other category of zirconia is that you do have zirconia which does have different layers, or I can use the word gradient as well. So when we are saying different layers, means that there is a transition of translucency from the cervical end to the incisal. Manufacturers do multiple different processing techniques in order to achieve that. One of the techniques is you will just change the color. Okay, once you change the color, it gives you kind of like that artifact that one end of the zirconia is more translucent versus the other end, but that's not the reality. It will not give you that natural looking appearance. Whereas Ivoclar does have a unique technology that is what we call it as GT technology. And in that, why it is unique? Because in that we do add two different powders. Remember, I said there are three different types of zirconias, 3Y, 4Y, and 5Y. And in this GT technology, we are mixing two powders at a time. So we do have 2/3 of the puck is your 3Y or 4Y, depending on the product. And then on top, the incisal edge is 5Y. Okay. Now, why it is unique and why it is different? In general, Kirk, 5Y is more translucent, whereas 3Y is comparatively most opaque and 4Y comes in between. So when you do have two powders that are added and kind of like 2/3 with 4Y or 3Y, depending on the product, and then the top one is your 5Y, you do see a really good gradation or transition of translucency from the cervical end to the incisal end. Okay.
Right.
It's not easy to get it, Kirk. We do have patents on that. It's not easy. And I will just very briefly mention it, why it is not easy, because zirconia has different phases. The listeners might be thinking that I'm giving a biomaterials lecture, but the answer is no. But the different powders are sintered at a different temperature. So when you're trying to mix two different powders, then think it in the way one is sintering at a higher temperature and other is sintering at a low temperature. So it's not easy to do that at one temperature, and that's the patent technology that we do have it that makes this product unique. The biggest advantage is you still have the strength from your 3Y or 4Y, because these are the stronger material compared to the 5Y. So you still have the strength and you have a translucency as well from the 5Y to achieve the good aesthetic outcome that a clinician is looking for. And at the same time, it's for the lab technicians as well. Most of the time when zirconia is not that good looking, they are spending more time on the tabletop in their labs to give that aesthetic appearance that clinicians are expecting.
Yeah.
They are spending more time. When you do have the product which already has a good aesthetic, then they are spending less time. So it increases the efficiency for the lab technicians also. Sorry, I gave a kind of like a little bit longer answer because I really wanted to explain what exactly GT means and why GT is critical and why we are adding two different powders and what are the advantages.
Yeah. And I love this because one of the questions that comes up, or actually it comes up in these different, we're talking about color. People want to make sure, because you know how dentists are, they're super picky about color. And then you got the whole strength and reliability thing. So go back to like, you know, anybody that's like, okay, but tell me more like about the color, because they're so picky. Anything else you would add about that?
Yeah, you know, Kirk, I will add a couple of more things just to explain it on a better side. So as you mentioned about the color, I will add strength as well. Okay. So just to reiterate it, as I said, we have 3Y, 4Y, and 5Y. Okay. So 3Y is strongest, but more on the opaquer side. 4Y is in between 3Y and 5Y. And again, the translucency is in between as well, both strength and translucency. And 5Y is your most translucent within the zirconia category, but weakest as well. You asked about the color, right? Color in my mind is a combination of chroma, value, and translucency come into play as well. It's a combination of all these three different parameters. So again, all zirconias are not the same. You are trying to match the color with the natural dentition, but then the translucency come into play as well. And when you're trying to match zirconia with the natural tooth structure, you need some translucency also. And that's where the GT technology comes into play, because that allows lab technicians to kind of like adjust the restoration within the puck to get that translucency. And at the same time, we have optimized the shade of our product closest to the Vita shade guide as well. Okay. So chroma and the translucency are slightly two different topics, but I will say not all zirconias are the same, and manufacturing processes and all that stuff come into play that identifies the chroma of a product also. Okay.
Very cool. And then as far as clinical times too, I mean, you're actually shrinking the insertion time, right? Like,
yeah,
that's a big deal for a lot of dentists.
Yeah, no, Kirk, I will definitely say that. So again, as I said earlier, zirconia is a mystery. Zirconia is a mystery for many clinicians. And as we mentioned regarding the insertion time, I might kind of like expand a little bit on that as well. So as I classified different type of zirconias, I mentioned it, what are the strength of these as well. 3Y the strongest, 5Y is the weakest, and then the difference in the translucency. So whenever I talk with dental experts, I will use the word dental experts here, including the clinicians and the lab technicians. Whenever I talk with them, I ask that question from them is, do you consider your treatment planning based on the zirconia you select? And I don't get a very confident answer, because they think like, okay, zirconia is zirconia. So when you are saying about the efficiency, I would like to answer that in a slightly different way. Is if you are defining your treatment planning, considering which end product you will use, that is your 3Y, 4Y, and 5Y, you will have a prep that is the tooth prep according to that product. Okay. So if 3Y is the strongest, you can be most conservative in your tooth preparation for 3Y. Whereas for your 5Y, you have to be a little bit more aggressive. So if I will throw some of the numbers there, so minimal reduction for your 3Y is around 0.5 to 0.6 millimeter reduction. Whereas your 5Y can range from 1 to 1.5, depending on your cementation protocol. So now again, I'm kind of like, we are saying about the efficiency. If you will understand different Ys of zirconia, you will do the prep in that way. You will prescribe the right zirconia based on the patient's demand and the clinical situation. Once you are communicating it properly with the lab, you will get the right restoration, and your efficiency and your chairside time will increase.
All right.
Okay, so that will be helpful.
I love it. I love it. So we talked about color, talk about strength and reliability. Now let's talk about accuracy. When you talk about accuracy, that's one of the challenges most people have. Yeah. Is what determines accuracy? What would you say about accuracy, and what determines accuracy?
I will put it in, Kirk, on the scientific side. I said, like, I worked on the material side a lot. So there are multiple different ways of defining accuracy and precision and all that stuff, but I will make it very simple. From a clinical standpoint of view, I did the prep. my restoration should go in the patient's mouth and there should not be any open margins, right? That's what my wish is. If I do have all on X cases in that particular situation, I do have implant abutments and all that, my restoration should seat down properly, right? So all these things I need to look into that. Now, that being said, when we are talking about accuracy, for our GT technology, we mix two different powders. But again, how we are manufacturing these pucks, what we do, Kirk, is we have powders, we have to pack it into the pucks. Okay. Now, there are multiple different ways of doing it. What we do, which makes our product slightly unique as well, is we do two type of compression techniques. So we are doing it kind of like from sides and we are doing it from top as well. What it does is that it will compact the zirconia powders more accurately, more precisely, and we don't have voids in between. The reason why I'm saying it, Kirk, because when you do have a bigger restorations like on all on X, then in that particular situation, when you are sintering it, the product and the powders and all that are compacted so well and so accurately, you don't see the distortion at all. We were doing the research recently and we were trying to identify, do we see the difference with the other products as well? And we found out as our zirconia product that is prime and prime aesthetic. Okay, so prime is 3Y to 5Y, as I mentioned it to you, that we are mixing two different powders. So your cervical end is your 3Y and your topmost end is your 5Y, whereas prime aesthetic is your 4Y to 5Y. So what we saw that although we added two different powders, we are sintering it at one temperature, but again, the accuracy of these restorations that came out using these products was just phenomenal. Yeah. Okay, so we did not see significant deviation, and when we compared with the other products, we do see that other products distorted. So that is kind of like makes a huge difference in my mind as a clinician, that I'm kind of like relieved that if a lab is using this product, I'm relieved that I will get a really good, accurate outcome.
Right. I love it. I love it. You know, in a world where a lot of people in dentistry want everything, you know, we want everything. But we can't, we also know that like that's not realistic. We can't have everything all the time, every day. So let's play a little game. So when you talk about crafting the masterpiece, as most dentists want to, you know, let's talk about two things on a scale from 1 to 10, 10 being the highest. How important is beauty? Let's go there first.
10.
10. Okay.
Yes, I will say, right. Like you said that for the dentist, beauty is important. I will say, Kirk, on that side, I'm saying 10. It depends on the patient's expectation as well. Okay. I would like to deliver the gorgeous looking restoration. That will be my wish. That it should match to the tooth structure most accurately. But in the posteriors, I will say aesthetic will be around 5 or 6. I'm not that much worried, but on the interior, I really want to match the shade and I really want to have good aesthetic. So for interior, I will score 10. For posterior, 5 is good enough.
Okay, good answer. Good answer. All right, same question. On a scale from 1 to 10, 10 being the highest, how important is strength?
I will say for posterior 10. Now I will switch it for posterior 10. For anterior, I will say 6.
Why?
The reason is because the masticatory forces that we are applying it. So when we bite, the posterior on the back end, we are applying too much of forces, whereas on anterior, I'm not applying the same amount of forces. So the strength is important always, but not to the highest degree. So I will throw some of the numbers again, Kirk. Again, I'm a biomaterials person and I love to share the research as well. So I mentioned it, 3Y is strongest, 5Y is weakest within the zirconia category. So what does it really mean? So 3Y has a frictional strength of, I will say 1,000 and 1,100, okay? The frictional strength is 1,100 for 3Y, whereas 5Y is 650. So think it in the way, one is strongest, one is kind of like lower the number, weaker the product is. So you have 650 versus 1,100. So 5Y is more indicated for interiors, or many clinicians are using 5Y in the interior because of the higher translucency, whereas your 3Y is used in posterior. Why? Because of the same rating. As I said, I need stronger product in my back, in the back of my mouth, and in the front. Again, I can use 5Y, but then that being said, I still prefer to use lithium disilicate in the interior versus zirconia, just because I know the aesthetic makes a huge difference for me. And I said 10 for aesthetic in the interior, and I know my lithium disilicate will be the best option for interior. That is my Emax lithium disilicate. So I will prefer that for my interior, and might be the zirconia for the posterior.
Yeah, I love it. I love it. What do you think most people get wrong about zirconia? If the first thing comes to your mind.
I will say, Kirk, sorry to say, I will say everything.
Everything.
I will say the most important thing is the most important thing here is this. Everyone thinks zirconia is strongest. No doubt about it, zirconia is strong, but please understand 3Y is strong, but not 5Y. Okay. So 3Y, yes, it's the strongest product and you can put it anywhere in the patient's mouth, but the limitation is it is not as good looking.
Yeah.
Whereas your 5Y, it is not strong. So zirconia is not one solution for all clinical indications.
Right.
Okay. And they need to understand that there are limitations to zirconia as well. So one thing, if I will say that people think about zirconia is the strongest, it will not fracture and all that. And that's not right, unfortunately. Yeah. I've seen zirconia restorations fracturing as well. And I have seen good clinical data on that side that your 5Y zirconias are fracturing.
Yeah. I love it. I love it. You know, having any expert like you, especially a biomaterials expert, I always want to know, and you can share what you want, but like it's anyone's guess. But
Yeah.
You're privy to so many cool conversations. What's the future look like? What do you think the future? I want you to predict the future.
Oh, Kirk, I need the kind of like a future ball to predict it and all that. But the future, again, I think the demand of the patients, I will answer it in multiple different ways. The patients will definitely look for aesthetic outcomes. Like we are talking right now, we are looking at each other. Everyone is seeing themselves as well on the camera. So the expectations of the patients will increase for sure. One, from efficiency standpoint of view, from strength standpoint of view, clinicians would prefer to have something faster, or lab technicians will like to have something fast as well, that will, in order to manufacture the restorations. So good looking, faster efficiency while maintaining the good clinical outcome. The future will try to solve these three factors with the new products in the market in the future. So yeah, so the products that will solve these pain points will succeed. And there are multiple different technologies. We talk about printing, we talk about milling and all that. So we are already there in printing. We are already here with the milling as well, but the technology will more evolve on the printing side to achieve these three different things that I just mentioned, it as the efficiency, aesthetic, and also the predictability of the clinical outcome.
Yeah. So well said, my friend. I love this. So give us some final thoughts on the whys and the whys of zirconia.
Greg, I will say if someone has to take the final message from this particular session, I will say, please understand which zirconias you are using. Not all zirconias are the same. You have 3Y, 4Y, and 5Y. 5Y is the strongest, 5Y is the weakest, and the 3Y is the strongest. But then that being said, all zirconias are not the same. If you can prescribe the zirconia that you do need, I mentioned about the gradient technology, I mentioned about the aesthetic, I mentioned about the predictability. Again, I have used Zircat Prime and Prime Aesthetic. I do know that how good these products are in terms of the aesthetic wise, in terms of the strength wise, in terms of the accuracy wise. So my message will be understand the product, prescribe the product, and do the treatment planning accordingly. And that will be the key for the success on the clinical side. And that will be really helpful. So if someone has to take one message, this is my one message, and that will be really helpful chairside, and you can use that information tomorrow.
Awesome. So well said, Shashi. Now I know people are listening, going to want to know more about how to, how to get hold of this information. Where do I go to learn more?
I will say, Kirk, we do have lots and lots of information on our website as well, ivoclar.com. So you can definitely look into the download center. You will see literature on that. But then that being said, we do have on our website, we do have an Academy tab. That's Ivoclar Academy. And we do have tons of information there also. If someone is looking for the in-person programs, we do have in-person programs to learn more about these. If someone is looking for webinars, we do have webinars. We do have professional tip videos as well. And we do have other literature. So please do visit our website. That will be very helpful to get the information. And again, if you want to interact, you can give us a call as well. We'll be happy to share and discuss different things. And finally, I will say Ivoclar sales reps are very knowledgeable. Reach out to them, ask from them different type of material options, different cementation protocols that goes with these products as well. And they will be more than happy to share this information. Ivoclar believe in education, and I'm here for 12 years, and that's what my role is right now. So I always get excited just because we believe in education, and we believe in sharing the highest quality information as well, Kirk. So yeah.
Yeah, and that you guys do very, very well. So Shashi, I can't thank you enough, buddy. Thanks for being on.
No, thank you. Thank you. I really enjoyed it. And I hope the information was helpful as well for the listeners. And yeah, thank you. Thank you for your time. I really had a really good time. So thank you.
I told you, I just love having people on here that are experts just like you and just talking about things that dentists need help with, best practices, things to think about. And I'm going to list all of what Shashi mentioned in the show notes. So if you're listening on the podcast, you can just flip up to the show notes and you'll see the links right there. It'll take you directly to those links that Shashi mentioned. I'm going to encourage you to check it out. Ivoclar is an awesome partner, and we only promote those partners that we strongly believe in. So stick around with Shashi while I say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. Hey, if you enjoyed today, do us a favor, just hit the share button. Keep sending us suggestions for things that you guys want to see, and we will line them up. So until we hear from you guys or see you guys again, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.